Today we will be studying the bone of hand. Now if you look at the hand, we have two surfaces, being the dorsal surface or the dorsum of the hand and the palmar surface or the palm. In the anatomical position, we study the bones of hand from the palmar aspect. So what we see from this part is the thumb is at the medial part, whereas the little finger is at the lateral part. We will be studying the bones one by one in the palmar position. Now when we see about the bones of the hand is divided into three types, being the carpal bones, the metacarpal bones and the phalanges. In total we have 8 carpal bones. When we talk about the 8 carpal bones, they are further divided into 2 rows, being the proximal and the distal. The proximal and the distal bone, they are further having 4 bones each. In the proximal bone, starting from medial to lateral, we have 4 bones. First is a boat-shaped structure or a bone called as a scaphoid bone, followed by another bone which is rather crescent shaped called as a lunate bone, followed by a third bone which is a 3-sided structure called the Trapezium Bone, and the pisiform bone which is a pea-like structure. I repeat, we have 4 bones in each of the 2 rows which we call as the carpal bones. In the proximal row we have 4 bones, in the distal row we have 4 bones. When we move from lateral to medial, we have a scaphoid bone which is a boat-shaped bone, a crescent-shaped bone which is called as a lunate bone, the Trapezium bone and the pisiform bone. The thumb is at the lateral end and the little finger is at the medial. Moving on next with the distal row, again moving from the lateral side towards the medial side, the first bone at the lateral side is the trapezium bone, followed by a little small trapezoid bone, followed by the largest bone called the capitate bone and the hamate bone. What we see the hamate bone as a distinct feature is a hook, which is called as the hook of hamate. These 8 bones consist of the carpal bones. The next we come is with the metacarpal bones. We have 5 metacarpal bones, the first one of the thumb and followed by 2, 3, 4 and 5 of the digits. The third bone we'll talk about of the hands is the phalanges. The difference about the phalanges is, in the thumb we have only 2 phalanges, whereas in the rest of the fingers or the digits we have 3 phalanges. When we talk about the thumb, these 2 phalanges, the first one is called as a proximal and the last one or at the edge one is called as a distal bone, the distal phalanx. Whereas in the digits where we have 3 phalanges, the initial one is called as a proximal, followed by middle, followed by distal. Proximal, middle, distal. Now let's study the associated joints with the bones of the hand. First let's talk about the wrist joint. The wrist joint is a complex joint in which we have 3 types of bones joining together, being the radius, the ulna and the carpal bones. Now when we talk about the wrist joint, as we have said already, the carpal bones is divided further into 2 rows, being the proximal and the distal. When it comes to the proximal bones, we had 4 bones being scaphoid, lunate, pisiform and the Trapezium bone. So when we talk about the proximal end, we had 4 bones being the scaphoid, lunate, Trapezium and the pisiform bone. From these 4 bones, only the first 3 being scaphoid, lunate and Trapezium bone form or contribute in the wrist joint together with the radius and the ulna, making up the wrist joint. The movements allowed at the wrist joint is flexion, extension, adduction, abduction and circumduction. The next joint is the carpal joint, which is between the carpal bones. Followed by the wrist joint, we'll do the carpal joints. The carpal joint, as the name indicates, is the joints between the carpal bones. These do not allow a lot of movement in between the bones, but they help in the movements of the hand being abduction, adduction, flexion and extension. Moving on, next is the carpometacarpal joints. When we talk about the first or the thumb, this carpometacarpal joint allows a greater degree of movement as compared to the rest. This allows movements such as flexion, extension, abduction, adduction and circumduction, while the rest of them have a limited movement considering only a little bit of flexion and extension. Followed by the carpometacarpal joint is the metacarpophalangeal joints, which is between the metacarpal bones and the phalanges. Followed by them is the interphalangeal joints, which is between the phalanges, allowing motion and stability, such as flexion and extension. The elbow joint is a complex joint in which we have three articulations between the ulna and the humerus, between the radius and the humerus, and between the radius and the ulna. Now, when we consider about the movements at the elbow joint, the joint between the ulna and the humerus and the joint between the radius and the humerus will allow the flexion and extension at the wrist, at the elbow joint, whereas the joint between the radius and the ulna will allow the pronation and the supination movements. When we talk about the elbow joint, the ligaments that provide stability are of four types. First of all, providing support to this joint is the joint capsule. The joint capsule is thickened in three areas which we term as ligaments. First, providing stability to the head of the radius is the annular ligament of the radius. Another structure providing support to it is the radial collateral ligament, whereas at the ulnar side we have another ligament which is called as the ulnar collateral ligament. These four ligaments provide support to the elbow joint. If you see a closer picture of the elbow joint, this is the humerus, the radius and the ulna. As I have mentioned already, it is first supported by the joint capsule, which is thickened in three areas forming three ligaments. First is the annular ligament of the radius, then the radial collateral ligament and the ulnar collateral ligament. When we talk about the muscles of the arm, we divide the muscles into an anterior compartment and a posterior compartment. In the anterior compartment, we have three muscles being the bicep brachii, the brachialis and the coracobrachialis. Now, once we remove the deltoid, we will be exposed to a number of muscles being the bicep brachii muscle, the coracobrachialis, the bicep brachii muscle and the brachialis muscle. I repeat, the muscles of the anterior compartment of the arm includes the coracobrachialis, the bicep brachii muscle and the brachialis muscle. The muscles of the arm is divided into two compartments being the anterior and the posterior. In the anterior compartment, we have three muscles being the coracobrachialis, the bicep brachii and the brachialis muscle. So, if we see, this is the bicep brachii muscle, this is the coracobrachialis muscle. When we remove the biceps head, we are exposed to the brachialis muscle. Also in the anterior compartment, we can see two nerves and an artery dividing into two. This is the brachial artery dividing into radial and the ulnar arteries. This is the ulnar nerve. This is the median nerve. This is forming the cubital fossa, which is a triangular shaped structure. The cubital fossa is a triangular structure in front of the elbow joint. It is formed medially by the pronator teres muscle, laterally by the brachioradialis muscle, and the base is formed by the two condyles of the humerus joining together. That's an imaginary line. The contents of the cubital fossa is the median nerve, the brachial artery or a division of it, and the tendon of the bicep brachii. When we talk about the muscles of the forearm, it is divided into 3 layers in the anterior compartment, being superficial, intermediate and deep. The superficial layer consists of 4 muscles, being the pronator teres, flexor carpi radialis, palmaris longus and flexor carpi ulnaris. When we remove it, there is a tendon of a muscle being cut, which is flexor digitorum superficialis. In the inner layer, we have 3 muscles, being flexor digitorum profundus, flexor pollicis longus and pronator quadratus. In the deep layer, we have 3 muscles, being pronator quadratus, flexor pollicis longus and flexor digitorum profundus.